What if one vitamin at night could help support your sleep, restore a bit of daytime vigor, and yes, make it easier to feel confident in your sexual health again? I'm Dr. Julia Morgan, a board-certified urologist, and I know that sentence sounds bold. I also know men over 60 are tired of being told the only answer is, it's just age. So let's be clear from the start. I'm not promising a miracle. What I am offering is a patient-centered, evidence-aware approach you can try at home that combines one simple nightly supplement with a 60-second external perineal routine, breathing, and short walks. Together, these habits may help improve circulation, reduce pelvic tension, support deeper sleep, and over weeks, if consistent, lead to meaningful gains in daytime energy and confidence. Too often, we blame hormones or time alone, but many of the changes men notice with age have to do with circulation and chronic tension in the pelvic area. Think of it like a garden hose that slowly developed a kink. Less blood flow and more tightness mean less sensitivity, more urinary bother at night, and poorer sleep. Poor sleep then feeds back into fatigue and lower libido. If we target the physiology, the kinked hose, the tight muscles, and the sleep disruption, small, consistent habits can make a real difference. If that sounds like something you're ready to try, hit like and type ready in the comments so I know you're with me. Let me explain the physiology in plain terms. The pelvis is a compact area where nerves, blood vessels, and muscles all run close together. The pelvic floor muscles support bladder and bowel function and influence blood flow to the genital region. Sitting too much, chronic stress, and even shallow breathing tighten those muscles over months and years. When muscles are tight and blood vessels are constricted, the local tissues get less oxygen and feel less responsive. At night, if circulation is poor, you may wake more often to urinate or not reach the deep stages of sleep that restore energy and sexual function. So improving circulation and helping those muscles relax is a practical target, not a replacement for medical care, but a concrete, treatable part of the problem that many men overlook. Why a vitamin at night? Certain nutrients support muscle relaxation, vascular health, and the quality of sleep, three elements we want to address. Magnesium, for example, is known for its role in muscle function and calming the nervous system. Some studies and clinical experience suggest it can help with sleep quality. Vitamin D is associated with general energy, immune function, and has links to mood and muscle function. Zinc plays roles in cell signaling and reproductive health. None of these are magic bullets, and not every man needs the same thing. But for many men, a single, thoughtfully chosen supplement taken at night can create a more favorable physiological environment. Muscles that relax more easily, sleep that's deeper, and circulation that's easier to restore with movement and local massage. That's why I recommend discussing these options with your healthcare provider to identify the right choice for you and to check for interactions with medications like blood thinners, diuretics, or heart medicines, as well as to consider kidney function. If you're considering starting a nightly supplement, talk to your clinician. Ask whether magnesium, vitamin D, or zinc, or another nutrient fits your health profile. Ask about possible interactions with any medications you take and whether blood tests are advisable before starting or monitoring therapy. Again, this is a supportive habit that some clinicians recommend. It's not a definitive treatment for any medical condition. Now let me walk you through the practical, complementary routine that amplifies what a nightly supplement can do. The core is simple: one vitamin at night, 1 minute of external perineal work, and then a brief breathing exercise, with daytime walking to keep circulation active. The perineal routine is external only. It's gentle, it's safe when done properly. It's not internal, it does not involve penetration, and it should never be painful. Here's the 60-second perineal routine I ask patients to try. First, find a comfortable position. Sit on the edge of a chair with your feet flat on the floor, or lie on your back with knees bent and feet on the bed. Clean your hands with soap and warm water. If you plan to use a topical oil, warm a small amount between your palms and do a patch test on the inside of your forearm at least 24 hours earlier to check for allergies. Oils commonly used anecdotally include castor oil for its traditional circulation-supporting reputation, coconut oil for gentle glide, or black seed oil for those familiar with its traditional use. None of these oils are cures. They're options for comfort and easier motion. If you notice irritation on the arm during patch testing, do not use that oil. With clean hands, place your index and middle fingers gently on the soft area between the scrotum and the anus, the perineum. The right pressure is like checking a ripe tomato, noticeable but not painful. If you feel any sharp pain or bleeding, stop immediately. For about 30 seconds, apply slow circular motions, small clockwise circles. Then switch to counterclockwise for about 30 seconds. Another option is a sequence of a 5-second gentle press, then release, repeated for 1 minute. The goal is to encourage warm, local blood flow and to signal your nervous system to relax the pelvic floor, not to force anything. If you have tenderness from surgery, prostatitis, recent procedures, or if you are on anticoagulants, check with your provider before trying this routine. After the minute of gentle perineal work, sit quietly and do 5 rounds of paced breathing. Breathe in for 4 seconds, hold gently for 2, and exhale slowly for 6 seconds. This 4-2-6 pattern nudges your nervous system into the parasympathetic, or rest and digest state, which supports sleep onset and muscle relaxation. The breathing should feel slow and controlled, no strain. Finally, if it's convenient, take a short 10-minute walk after dinner on most days. Light movement helps keep pelvic blood flow active and reinforces the effects of the nightly ritual. I want to be very clear on safety steps. Keep the massage external only. Do not insert fingers or instruments. Use only clean hands and a small amount of oil if you choose to use lubricants. Stop right away if you feel pain, experience bleeding, or note smelling. If you've had recent prostate surgery, radiation, a biopsy, or active infection, talk to your urologist before trying this. If you take blood thinners, have severe cardiovascular disease, or significant kidney problems, consult your clinician to confirm this routine is safe for you. These precautions protect you and ensure the habit is supportive, not risky. Let me share a few short anecdotal stories from men I've worked with to give a sense of what consistency may bring. These are single patient experiences, not research claims, but they do illustrate how modest changes can add up. Robert, age 64, told me he began a nightly magnesium supplement after discussing it with his primary doctor and coupled it with the 1-minute perineal routine. Within a week, he noticed falling asleep faster and fewer trips to the bathroom at night. By week 3, he reported feeling more energized during afternoon walks and a subtle improvement in confidence in intimate moments. He describes the change as small but steady, and he stressed that sticking with the routine mattered more than intensity. James, 70, had been living with chronic pelvic tension and poor sleep for years. He added vitamin D to his regimen after testing revealed low levels, and he adopted nightly breathing and the 60-second external routine. He felt calmer overall. His nocturia decreased slightly, and he regained a sense of control over bedtime anxiety. Again, James's experience is anecdotal and individual, but he found the combination practical and easy to keep up with. Daniel, 65, emphasized how the short, external routine removed the stigma and discomfort he felt about doing therapy at home. He liked that it took only a minute and that he felt safer trying a supplement at night after checking with his clinician. He said the biggest win was feeling proactive rather than resigned to "this is part of getting old." Remember, these are individual experiences. Results vary. Some men see subtle changes in days, others need several weeks to notice consistent differences. In general, most men report incremental improvements over 2 to 4 weeks when they use the routine nightly: 1 vitamin at night, the 1-minute external massage, paced breathing, and regular light movement. The emphasis must be on steady adherence rather than seeking instant outcomes. A few practical notes to keep you safe and grounded. Do not change or stop prescription medications without your doctor's guidance. If you experience sudden loss of function, new or severe pain, bleeding, fever, or unexpected urinary changes, contact your healthcare provider promptly. If you are on anticoagulants, have recent urologic surgery, or have active prostate issues, get personalized clearance. If you're unsure whether a supplement is safe for you, ask your clinician about blood tests, kidney function for magnesium safety, vitamin D level for supplementation decisions, and routine checks for any medication interactions. I also want to address the supplement conversation specifically. When we talk about one vitamin at night, that phrase is an anchor, one simple, consistent habit you do at bedtime. A clinician might suggest magnesium for its muscle-relaxing and sleep-supporting properties, vitamin D if your levels are low and you need general vigor support, or zinc if there are specific reproductive or nutritional concerns. But no supplement should be started blindly. Ask your doctor or pharmacist about potential interactions with blood thinners, diuretics, or heart medicines. If you have kidney disease, some supplements require special caution. Your provider can advise what to test and how to monitor while you try the nightly regimen. Let's also be honest about expectations. This approach supports function, but it's not a guaranteed cure for erectile dysfunction, nor is it a substitute for treatments like medications, devices, or surgical interventions when those are indicated. Consider this a supportive, conservative strategy designed to reduce pelvic muscle tension, improve sleep architecture, and boost local circulation, factors that matter a great deal to sexual health and daytime energy. If you're thinking about trying this, here's a simple 3-week challenge to keep things practical. For 21 nights, take your chosen nightly supplement after speaking with your clinician, perform the 1-minute external perineal routine in a relaxed position, follow with 5 cycles of 4-6 breathing, and aim for a 10-minute walk during the day, ideally after a meal. Keep a simple journal. Note sleep quality each morning, number of nightly bathroom trips, and any changes in daytime energy or comfort. Small, consistent steps help you see what's working and what needs adjustment. After 3 weeks, review your notes with your healthcare provider and decide whether to continue, adjust, or try other options. Before I close, I need to say this clearly and read the important medical safety language. This video is for educational purposes only and is not a substitute for medical advice, diagnosis, or treatment. If you have pain, bleeding, a history of prostate disease, or recent urologic surgery, are on anticoagulants, have significant cardiovascular disease, or are taking prescription medications, consult your healthcare provider before beginning any new supplement or physical routine. Stop any self-care practice immediately and seek medical attention if you experience severe pain, swelling, bleeding, fever, or sudden changes in urinary or sexual function. If you found this helpful, consider subscribing for weekly science-aware men's health tips. Share this with a partner or friend who might benefit, and comment below with "Ready" if you're going to try the 3-week challenge. In the comments, feel free to ask questions, but remember, I can't give personalized medical advice here, and your clinician who knows your history is the best person to guide your supplement choice and safety. To recap succinctly, a single nightly supplement, chosen with your doctor, may support muscle relaxation and sleep. When combined with a gentle, external 1-minute perineal routine, paced breathing, and short daily walks, it becomes a simple nightly ritual that targets circulation and tension. Be consistent for a few weeks, pay attention to safety, and keep realistic expectations. Small habits, repeated, have the power to change how you feel overnight and across weeks to give you steadier sleep, more daytime energy, and greater confidence. Thank you for trusting me to walk you through this practical approach. I'm Dr. Julia Morgan. Take care, be safe, and talk to your doctor about which nightly vitamin, if any, is right for you.